have case growth that's on a trajectory right now that puts us in grave danger in about a week, 10 days, not having the ventilator capacity we need to render the best medical care to individuals. We need to make sure that we flatten that curve. And I know you and everybody who watches your program, they've heard this said for so long that I'm not sure that it's registering with them. But the fact of the matter is, if we don't slow the spread and extend the duration of this event, we're going to have too many people who need health care all at the same time, and we're going to overwhelm our capacity to deliver that care. The first issue in the order of importance happens to be ventilators. And as you know, that puts us in the same boat with New York and other places. And there are only so many ventilators in the world, and they can only produce so many at a time. But that really is the biggest concern that I have. So as we do everything we can to ramp our surge capacity up to deliver more health care, we need the public to do everything they can to slow the spread, which is why we put in place these non-pharmaceutical mitigation measures, social distancing, the stay-at-home order, only essential businesses being open and only essential workers going to work. And I'm encouraging everybody that just because under the order you can go to the store, you shouldn't go to the store every day. And not everybody in your household needs to go to the store when you do. You ought to be leaving the house once every 3 or 4 days. And if you need to stop by the bank and get some money, do that. If you need to go to the gas station and get some gas, do that. But we need to make sure we slow this spread, minimize contact. It really is as simple as this. Stay at home, slow the spread, and save lives.
What type of compliance are you getting from the people of Louisiana? Because I keep hearing from my folks who live in Lafayette who say that the parks are packed like they would be on any other day.
Yeah. Well, first of all, we're getting really good compliance in many places. It's lagging in other places, but I was talking to the mayor of New Orleans the other day, and she tells me that her people are getting it. And where you see the numbers and the real problems that are happening on the ground, obviously it's easier to get that sense of urgency in the population. So that's happening in New Orleans. It is happening around the state. I wish we could get people's attention before the number of cases in their communities grows to the point where they're forced to pay attention, because if we could, we know that those numbers would be even lower. But look, we don't really mind people going outside and exercising, but they shouldn't be congregating. You've got to have your social distance, and you shouldn't have too many people in one spot. But if people want to go and walk around the block, if they want to go bicycling or something like that, we understand that. But we shouldn't have people congregating, whether it's in a building or whether it's outside in close proximity to one another. And so we just keep reinforcing the message. We're trying to enlist the aid of all the local elected officials, legislators, faith leaders. We're trying to get people to go on TV, the medical community, go on TV and radio to really spread this message, because really the only shot that we have to be able to have even our surge capacity to be adequate to the task is to slow the spread. In Region 1, down around New Orleans, we are on a path that by about April the 3rd or 4th, we will run out of ventilators. And so that's what we know. And we're ordering ventilators from the national stockpile. I don't have any information on those yet. We've got about 7,000 orders in with private vendors, and we've had these orders in for a long time. Thus far, we've been able to acquire exactly 192. And so it's helpful, nowhere near enough just for the New Orleans region, much less what's going to happen elsewhere around the state. And this is a statewide issue. Some people think it's only in New Orleans because that's where the headlines have been nationally. But in Northwest Louisiana, we have seen tremendous growth, 140 cases in Caddo Parish, up around Shreveport, 37 next door in Bossier. And so the idea that you redeploy ventilators from elsewhere to New Orleans, well, that only works for a few days, and then they need those ventilators right back where you took them from. So this really is the area where we have the most pressing, most urgent need, and we keep reinforcing that with the federal government and with these vendors, and of course we're working as hard as we can. But I don't want to kid anybody. The progress is not sufficient.
you have had some good dealings with the federal government, and I'm only judging that by a conference call I heard you have with the president, where you simply said, hey, our per capita is rising considerably. I need this. You asked for 2 field hospitals, my understanding is, and you essentially got them, right? So 500 or so beds. Can you tell us about what that looks like and where it will be located?
Yeah, so we've had a good relationship with the federal government, whether it's the president, the vice president, FEMA, HHS, and we actually requested, just so you know, 4 250 unit field medical stations. We were approved for 2 of those, so that's 500 beds. Okay. Those beds, and it's more than a cot. It's more like a hospital cot, if you will, with IV poles and so forth. They will go to the Montreal Convention Center to help us stage there our surge capacity, where we're going to have over 1,000 beds online in just a few days. We also were approved for a 60-person strike team from U.S. Public Health Service. So this is the next to ventilators. The most critical thing we need are staff. We need doctors and nurses and respiratory therapists and so forth. So those 60 people will come and augment the staff that we're going to bring in pursuant to a contract that we have with the staffing contractor, and we're going to surge at the convention center over 1,000 beds. These will be less acute patients, and so it will allow the hospitals like Oxnard and Truro and so forth to discharge non-acute patients earlier than they otherwise would be able to do that, and free those beds up in order to take more patients. So that's what we're doing in New Orleans. But the federal government has also approved a major disaster declaration here. I think we were the 4th state in the country to get that declaration. We have on the ground an epidemiological team from Health and Human Services, from the CDC, I should say, that's helping us to manage some clusters that have broken out in various communities around the state of Louisiana. So we just got from the national stockpile a rather large shipment of PPE. More than 100,000 masks came in last night, for example. So things are coming. We don't have everything we need, and we don't have it in the quantities that we need. But we've had a good working relationship. And look, this is a very difficult situation. And David, this is what I would like for you and everybody else to understand. Normally, when we have a disaster, it's a natural disaster. And it's a hurricane, it's a tornado, it's a flood, but it doesn't hit every part of the country at once. And so we're able to get meaningful and timely, significant assistance from sister states and from the federal government, because they're all focusing those resources on our state. This is unlike that, because this is a public health emergency that is across the country. And so we're competing with every other state for the same supplies, whether it's PPE, ventilators, staffing, you name it. And we're also competing with every other state for the time and attention of our federal government. And so
the president said yesterday that governors need to do more to help themselves. What's your reaction to that?
Well, I don't know how to do more than I'm doing. And I didn't exactly hear him say that. And I hope that was not a criticism of our efforts here. He and I have actually had some really good conversations about this particular emergency and what we're doing at the state level, what assistance he's able to bring to us. We are doing everything that we can to make sure we surge our medical capacity, that we deliver the right messaging to the people to slow the spread. And so I'm not going to be critical of his comments. I didn't hear them. I don't know what he intended by them. And I don't know whether they were directed here at Louisiana.
They were not. He did not name you. You were not one of the ones that he named. Governor, you announced yesterday that Delta Airlines is flying people for free who are medical workers who would come here to work. Yeah. What is the state doing for, let's say, a doctor in Maine who says, I want to go to Louisiana and help out? How easy is it for that person to get the approval to get there and get to work?
Well, that doctor in Maine, and by the way, I welcome that doctor to come to Louisiana. That doctor, a nurse, respiratory therapist, you name it, any medical professionals, go to lava.dhh.louisiana.gov. So lava.dhh.louisiana.gov, and you can register. And when you register, that will allow you to be credentialed. It will allow us to know who you are, and we can direct you to where You are needed when you get to Louisiana, and we really appreciate Delta because we're one of just a handful of places where they're doing this, where they're going to fly those individuals in for free. And so that would be extremely helpful for us. As I mentioned a while ago, next to ventilators, the number one issue, most pressing, it happens to be staffing. And so if this helps us to get some additional medical professionals in Louisiana, that would be extremely helpful.
You announced, Governor, within the last 48 hours that 69 of the people who died were diabetic. Can you tell us more about what you know regarding those who have died, and what kind of underlying conditions they had?
Well, David, this is what I know, and it's consistent with what we were told at the outset. The most vulnerable populations are those that are older, 65 and older, and those with underlying chronic health conditions, such as diabetes, hypertension, and then obesity as well. And that is what's playing out. And certainly, if you have people who are over 65 with those underlying chronic conditions, then those individuals are most vulnerable of all. But it is also true we had a 17-year-old who, and the investigation isn't complete, but we had a 17-year-old in New Orleans the other day die, and as best we could tell, that young man was healthy. And so nobody should think that they're immune from the worst possible outcome if they catch COVID-19. And you know, this is a very, very difficult disease, and we need everybody doing what they can to protect themselves and to protect others. But we know, you know, it's no secret. It's been this way for generations in Louisiana. We have had more than our fair share of people with underlying health conditions, whether it's diabetes, hypertension, obesity, and those sorts of things. And I think that probably when this is all over will account at least for a part of the number of deaths that we have in Louisiana, which yesterday at noon, and this is sad, this is tragic, we reported 119 deaths in Louisiana. I think that's about 10% of all the deaths in the country right now. I'm not exactly sure where we are, but that is very distressing to us, and we'll know more about this as time goes on as to whether the most vulnerable population in Louisiana was disproportionately affected by this, meaning that's where the virus hit first, or what the situation is. But we know we've got work to do to improve the health of all the people of Louisiana, which is one of the reasons we expanded Medicaid so that 460,000 more people would have health insurance. And I have to believe that we're actually healthier today than we would have been had we not done that. But we still obviously have a ways to go.
Having people be personally affected and hearing personal stories is one way to get people to pay attention. Yeah. And I want to ask you to tell us some of those personal stories. But before you do, I want to tell you that some of this all started with me hearing from a doctor in New Orleans who said, David, Louisiana is not getting the kind of national attention that it deserves. So we started, CBS News now has a team on the ground. I would be there, but I can't leave my apartment. But one of the most sobering stories I heard was from your former health secretary, Dr. Rebecca Gee, who said they're ordering gowns off eBay. They're talking to somebody's brother, sister's friend who knows a lady who used to buy plastics and perfume from China. But now she's getting masks, and the state of Louisiana is buying, well, she's buying them for LSU, the system she runs, at twice the cost. What are some of the most sobering stories that have been brought to your desk that will help people get it?
Well, David, the truth is, if we were only paying twice the normal cost, we would feel very blessed. We're paying 4 and 5 times the normal cost, for example, for an N95 mask right now. And the story you heard from Dr. Rebecca Gee is not unlike what's happening right here in Baton Rouge at the Governor's Office of Homeland Security and Emergency Protection. We're chasing down every lead we can to find PPE, to look for ventilators. And we're doing that here in our country, and we're doing it literally around the world. And so this is probably the hardest part of this, because we have a rather disjointed effort around the country right now, where we have hospital systems, we have individual hospitals and so forth. We have states and the federal government all out there trying to procure the same thing at the same time in large quantities. And so we're driving the price up because of all this demand, and we're undercutting one another because every now and then there will be an order that you think has been confirmed and a shipment that's going to be sent to you only to find out it's canceled because they sold to somebody else, and in some cases the federal government. So this is a little bit disjointed. Now, we have seen some improvements here in the last couple of days. I told you that last night we got over 100,000 N95 masks. So it's not all doom and gloom, but it's not the system that you would like to see. But, you know, of the 119 deaths, 2 of those individuals, at least 2, work for the state. There's a third young lady who I know very, very well, and she's in the hospital right now in an ICU and on a vent and, quite frankly, not doing well. And the idea that she's there in a room by herself without her mother, who is her caretaker, primary caretaker, and going through this, you know, when I think about that, I just, you know, those are the things that really develop this real sense of urgency, because I want to limit the number of people who have to go through that. I want to limit the number of people to the lowest number possible who actually die from this disease. And that's why we're working so hard. And it's why I keep, you know, pounding this message. There is something people can do. We to a large degree can control how bad this gets for our state and for our nation, but it comes through this social distancing. And while that's a simple message, there's a lot of people out there who are very slow to pick up on it and to practice what we are preaching. You know, so I'm hopeful that people will do better, and maybe this talk with you and you putting this on CBS News will spur them to action. And the action we're asking for is inaction. Stay home. The way that you can be a good neighbor in this incident is don't go pay a visit on people. Call them, Skype them, FaceTime them. But show your love for people by not making contact with them until this is over. And there's going to come a day when we're all going to celebrate and dance again, and we're going to be going to LSU football games and so forth. But that day is not now. And the sooner we come out of this, the better. But we will play a big role in what that looks like.
Last question is about your mother. I put my parents at the farm in Sunset, and they are away from anybody.
Yeah.
You've been verbal about your mother, and she's alive and well. And what are you doing? You know, here you are telling the state to do something, and she lives not too far away. What are you doing to make sure she is safe?
Well, she lives with one of my brothers. She's 84. She is doing well. She lives in a cabin on the Tangipahoa River and in the middle of about 300 acres of woods, and she is staying there. And only my brother is going through the gate because we know that she does have some underlying health conditions, and she's one of those that's most at risk. It pains her, but she's not going to mass every day like she normally would. She's not going to visit friends and so forth. But she's a nurse. She was a registered nurse at a charity hospital system for 30 years. She understands this. Her mother was actually 17 years old in 1918 when the Spanish flu pandemic swept through. And so she remembers the stories from her mother about what that flu did. And this is the first time in 100 years that we've seen something like this. So my mother's doing exactly what she should be doing right now. And she's calling her son frequently for updates, I can assure you.
It's personal for all of us, Governor. Thank you for the time and the context.
Thank you so much, David. Appreciate you. And I hope you get out of your apartment at some point, not too long.